manufacturers, the vaccine has announced that as many as 90 million doses of the jab destined for COVAX worldwide will be delayed to allow the Asian country to address the local spike of the virus amongst its 1.4 billion people. Africa's Center for Disease Control, CDC, says Africa is unlikely to meet its target for vaccinating the continent against COVID-19 if supply delays from a key Indian manufacturer continue.
This is a virus that is mutating, and it is going to continue to mutate unless we stop it from mutating, and the easiest way to stop it is to prevent transmission. And that is where the vaccines are so critical, that if we immunize quickly and at scale, then the issue of variants will go away.
Head of Africa's disease control further warns that India's move to shelve exports of Astra-Zeneca's 2-dose COVID-19 vaccine will undermine the continent's inoculation plans and could have a catastrophic impact.
It will definitely impact our ability to continuously vaccinate people. The first wave of vaccines came in through COVAX, and it was predominantly from Astra-Zeneca from India, from the Serum Institute. And if the delay continues, I really want to deliberately hope that it is a delay, not a ban, because that would be catastrophic if that was the case. Then meeting our vaccination schedule will become problematic, very, very problematic, I think.
India is racing against time to fast meet local demands, and as many as 90 million doses of the shot destined for the COVAX initiative worldwide will be delayed through the end of April. The hold will definitely impact Kenya's continuous ability to vaccinate people as the government relies on the vaccine. So far, about 196,000 Kenyans have received their first dose of the jab, and counties are already signaling its shortage.
Kama madaktari yetu wanaweza kutembea hata kwa maofisi ya chiefs, sana sana mahali wananchi wanapenda kwenda, wakuja wawapokee, wawadunge shindano.
The country, according to the Ministry of Health, expects another consignment this month.
The government assures those who have already taken their first dose of vaccines outside the government deployment plan by this date will receive their dose when due.
The first group received the vaccine on the 5th of March and is scheduled for the second jab on the 30th of April. Meanwhile, Kenya is experiencing an acute shortage of antiretroviral ARV drugs, which has hit public hospitals greatly, affecting people living with HIV and AIDS. The Pharmaceutical Society of Kenya, PSK, reveals that persons living with HIV are having to endure reduced doses, with children and unborn babies particularly poised to suffer. On contention is a 90 million shillings tax standoff between Kenya and a U.S. importer of ARVs, USAID. PSK now urges President Uhuru Kenyatta to urgently instruct the Foreign Affairs, Health and Finance Ministries to solve the diplomatic matter between Kenya and USAID.